Good morning. I'm Dr. Philip Umschner at the Ozark Chiropractic Clinic, and I'd like you to welcome to our video this morning. I've often asked you for ideas. What are topics you'd like to hear about? And I just saw my niece this past weekend, and she just had her first child, and they're both doing great and well, and I appreciate seeing them. And she says she watches the videos, and I said, well, great. And I asked her, what ideas you have? She said, well, how about kids and babies? I said, there you go. So we're going to talk about chiropractic care for babies, children, infants, and let's get started. So most people right away are going to think, well, what does a baby or an infant need chiropractic care for? What goes on? Okay, well, that's a great question. Now, if you think about it, at the birth process, what's happening there when that baby comes out and is delivered? They're going to grab the head, it's going to be twisted to get a shoulder out, twisted again. So there's a great deal of trauma that's occurring right to the neck, right from the get-go. So that can start problems right there with some children. Not everybody, but some children, okay? So that's something that can occur. Then, what do children do as they grow? Well, they learn to walk, and they fall, right? Then they learn to ride bikes, and they fall. And they learn to do this, and they fall. You see the picture, right? So there's a lot of things that go on that cause a lot of wear and tear and bumps and bruises to our kids as they grow up. And that's normal. Now, all these falls and injuries can cause problems that'll slowly start to develop as time goes on. And that's one thing I think as adults can recall, is that a lot of patients I've had through the years can recall specific incidents that might have happened decades ago where they hurt themselves and they've had problems ever since. And it's like I'll tell all our patients that all the falls and injuries we have, your body kind of remembers them and builds up. So over time, that's where you start seeing more problems. So the point is that if you can start to take care of your children at a younger age, take care of some of these problems so the body heals better, and it's not going to give them as much problems down the road. And that's a very important factor there. So how do we adjust children? Well, people are always afraid, what do you do? Because if you've been to an adult, you've been to a chiropractor, you know what it's like. It's not the same thing. No, we adjust a baby or an infant. Oftentimes it's using fingertip pressure, little pressures like this. I have what we call an activator. This is an adjusting instrument. And we use this on adults also, but you can set the force of the pressure and you're going to get a little like that. And that's it. And that's very gentle. It works very well for children and adults also. So that's how we'll adjust a baby. Oftentimes I will have the mom lay on the table on her back. She'll hold her baby on her chest, act as the table, and we can just do our checks right then and there. Whenever we check a baby out, do an exam, we do not do x-rays on children or babies. I like to wait until they're maybe into the teens. Depends if they've got scoliosis and things are changing, we may do there. But most part, we don't like to x-ray children at all. So we don't want to expose them to anything that way. As they get older, then we'll start to adjust a little more conventionally like an adult. But again, it's just all modified for how old the child is, what they can tolerate. It's just the same as I would do in an adult. I don't adjust everybody the same. It all is on your particular wants and needs and what your body tolerates. Now, that's a great thing to think about, is that as your child grows, it just helps their bodies develop better, because there's also much wear and tear. I've got a funny story. Our oldest daughter, who also will be having a baby in February, so it'll be our first grandchild, I'm proud to say, and that's exciting. But we're teaching her how to ride a bike, and we're in the backyard. And we thought this would be easier than, maybe on the street where fall on the concrete or something, hurt yourself. So we're in the backyard, a little bit of a hill. And so we told her how to work the bike, the brakes, and so she's going, she's coming down, and she's getting close to the fence where we're saying, hit the brakes, Kristen, hit the brakes, hit the brakes. Well, she doesn't hit the brakes. Needless to me, she hits in that fence, boom, bounces off, falls off. She's mad, upset, not really hurt, more mad with us and upset. And Mom and I are both concerned and laughing at the same time. If you're a parent, I think you know what I'm talking about and stuff. So there's an example of how kids do things to themselves. I had my old son. He was up as a youngster on top of a chair for whatever reason, up there, falls over, boom, lands right in his head. So things happen. Probably thinking, what type of parent am I? But if any parent knows, your kids do stuff. They get the falls, they hurt themselves, and that's life. So if we can check these things out, they're going to grow better, they're going to be healthier, and they're going to do better for it. Some of the conditions we treat for infants, things like colic, believe it or not. If they're not nursing well, having neck issues, you'd be surprised at things that can go. As children grow, ADHD, anything along those lines is working well, because you're going to look at nutrition, you're going to look at that spine. So there's a lot of different avenues you can take to help kids out and things. And I'm not a cure-all for everything, but this is another avenue, another alternative for you to think about. Okay? So I just want to thank you for your time today. As always, you can contact us on the website, ozarkchiropractic.com, like our Facebook page where it says that, and the old-fashioned way, call us, 667-5053. I'm here to answer any questions. But I thank you for your time. Have a great day. Thank you very much.